My real troubles came super in my face when I was 27 years old, starting with a brain bleed, and then they scanned my head and found that I had a Chiari malformation, which is when the bottom half cerebellum crowds the spinal cord and the brainstem, and the brainstem is in charge of heart rate and breathing and all motor function communications throughout the body, so the symptoms can be head to toe. And my main symptoms were just bad. Is this too much information?
No, that's good.
Really, really poor communication, concentration, big lethargy, just couldn't do things. But then when the brain bleed happened, it was definitely like, there's something wrong with me. So then they scanned my head, saw that, and the two together were really, really, really rare. They couldn't find a case on the books throughout the country that people had survived the combination. So we couldn't do surgery until the brain bleed had healed on its own. And so I had surgery on the Chiari malformation, and that was wonderful.
What did they do for the surgery?
They do a little craniectomy, and they open the dura, and they make more room, and they cauterize that cerebellar tonsil that is crowding down and pushing on the brainstem. And so that cerebellar tonsil gets up and everything goes back up where it should be. And they do Doppler stuff so they can see that the cerebrospinal fluid is flowing and everything's great. And then they take a piece of my dura to patch it in and make a nice patch so that gets bigger. And then first they put a metal plate on my skull where the craniectomy had happened, and then sew me back up. That was wonderful, huge relief of symptoms. And then gradually the Ehlers Danlos Syndrome comes into play, which is a connective tissue disorder where the ligaments are too loose and the joints become too loose, and this can be seen with a few little diagnostic tests, like people that can go like this, and my elbows do also. So my elbows, let's see. Can you see it? Okay, so a straight elbow.
Turn your hand down. There we can see it.
Okay, so straight elbow should be here. And mine just kind of goes like that, so it's a little more.
Okay.
They removed part of the cranium, and they also removed the back part of C1 and C2 to get into that area. So by removing that area of bone, if I didn't have Ehlers Danlos Syndrome, I think the connective tissue and all that stuff could compensate and be strong enough. But since all my stuff is loosey, my head started kind of just sinking onto my spine and had quite a bit of cervical instability. And then I was kind of getting more of the same symptoms because it was kind of crushing the brainstem a little bit from the front, and similar symptoms but a little bit different. So I had to proceed with the cranial cervical fusion surgery, which is, so I have titanium rods going from, I think C4 is right about here. Does that sound alright? C4 is right about here, and they go, this one I can start to feel when it gets to here, and it goes to there. That's the top of it. And then the other one is right there to about there.
Okay.
Okay, so the titanium rods are screwed in there, and there's no movement. C1 and C2 are a joint that move your head rotation-wise, so I don't have any rotation doing that. So that might be a big issue with what I'm dealing with TMJ type stuff. So quite a bit of loss of movement in the area with rotation.
Okay, open your mouth. Close. Open. Close. Good. Okay, so tell us about some of your symptoms that you came in for.
If I could use a metaphor, it feels like my body is that old game Operation, and if I move the slightest bit or move too fast, my body buzzes, and the nerves are just like, don't move, don't touch me. So the nerves are just live wires all throughout my body. So driving over here today, it's just like gritting my teeth, like, don't move anything, everything stay put. So movement hurts, movement of any kind. So tightness all throughout, everywhere, but I kind of like the tightness because it gives me support, so it's a double-edged sword. Migraine type eyes, vision is blurry and dizzy and wavy. If I were to be walking and there's shady trees, that makes me kind of sick. Too much motion to look at is really bothersome. Too much motion around me is bothersome.
Tell us about your headaches.
Also like that migraine-y feeling, just like pokey, really sharp and angry headaches through here.
How often do you get those headaches?
If I were to push myself and not listen to my warning signs of when I have to lie down and stop moving, it would happen every day. But listening to my warning signs, it only happens 2 to 3 days a week. To the point where I have to not do anything in the morning until my body's ready for about 4 or 5 hours, letting it wake up on its own until it's ready to move and be part of the world.
So how many hours a day are you active? That's part of your normal life.
Average 4 to 5 hours, but that is not leaving the house. That is just doing eating, which I hate eating, preparing food, eating, that's personal hygiene, that's basic chores around the house, 4 to 5 hours. I only leave the house 2 days a week, sometimes 3 days a week, because getting in the car is just more work, more impact on my body. But 4 to 5 hours is the average, usually like 3 to 4 in the morning, and then I have to rest, and then I get another 1 to 2 in the evening.
Okay. I'm just going to go over some of your symptoms. Just briefly, tell me about them. You mentioned overstimulation, migraines, headaches, dizziness, eye pain, ear pain, jaw pain. Tell me, we've covered all the pains. Is there any pains that I'm missing?
There's like this.
Back pain, low back pain?
Back pain's just inconvenient. Mid, shoulder, scapular area, that's moderate pain. There's like this thing that I call neuro storm or neuro flare, which is if I've really been pushing myself for a couple days, it's like my body flicks a switch and the nerves get so excited that all night long for a night it'll like send this constant charge of, it feels like down my brainstem, in my spinal cord, up and down all night long, and it feels like like an electrical storm. Burning, electrocution, and that's the worst pain of all, actually. And that's why I have to lie down in the afternoon, because I know if I don't, it'll kick into that. And some of the medications have dampened those feelings and had those storms happen less often. but they can still happen, and that one is excruciating.
And what are the medications you're on right now?
Gabapentine, topiramate, Cymbalta, which I don't think helps that much. The gabapentin I think is extremely helpful. Topamax has been very helpful. I take oxycodone too regularly for my liking. That's it. Those neuro ones are helpful, but not solving the problem.
What are your pains as of today? Because you've got the mouthpiece and I'm going to let you put it in for the first time after making all the adjustments to it. What are you feeling right now as far as your pains and your symptoms?
Pain level is probably a 5. Just making me do that open jaw thing made these muscles get a little more aware and a little more active muscle troubles. The nerves throughout to mid-back are not agonizingly sharp, but they're irritated, and troublesome.
Okay. Go ahead and put on your mouthpiece.
And pain and headache, which is always there, so I don't even realize it. So headache and head pain behind the eyes, and kind of sensitive to light.
Okay. Goes on the lower teeth. Flip it over. There you go. Good. It's in. Bite. Tap, tap, tap on that. Okay. Close your lips.
The first thing is the muscles just start relaxing in my neck, and that's huge with those rods in my neck. Those muscles are always tight, and to get that relaxation is really big. And now my shoulders are relaxing, and below my shoulders, like scapula area. And the nerves just get quieter, and that headache behind my eyes.
Are you still feeling the headache behind your eyes?
The sensitivity to light is a little bit there, but the headache is just kind of lifted.
And as far as the sensitivity, is it the same, a little bit less, a little bit more?
Quite a bit less. Medium less.
Okay.
But the muscles just melt away. I don't know if you can hear me sighing, but my friends call it purring. When I purr, and that's like when I start feeling good, like when I take a painkiller, is I'm purring because it starts to get some peace in my body and some relief. But this is better than painkillers because this is like real and not just covering it. So so it's going down my back more, like down here, and some muscles and nerves are just kind of loosening up together.